What's up guys, welcome to another week's episode of GetPsyched. Now this week we're going to be taking a look at a topic around about antidepressants. So we're going to be looking at antidepressants versus therapy. Now this is quite a hot topic in therapy right now and in the psychological world. There's a lot of information out there about antidepressants, there's a lot of misconceptions, there's a lot of uncertainty as well, and there's not much amount of certainty around how much antidepressants work compared to therapy. So this week we're going to be taking a look at that topic. What's up guys, welcome to GetPsyched, and like I said, this week we're taking a look at antidepressants versus therapy. Now the first question we want to ask is, what exactly are antidepressants? Well, they're prescribed largely for things like low mood, anxiety, even eating disorders and obsessive compulsive disorders, and although they're readily prescribed in the NHS by doctors, there's still a lot of uncertainty around how antidepressants actually work. But we do understand a little bit around how they work. Primarily, they manipulate and even block neurochemistry pathways or neurotransmitters in the brain that influence how we feel. Now that's a very general overview, but that's fundamentally what antidepressants do. One of the best ways to understand antidepressants is to understand the different forms of antidepressants. Now with different people and different issues that people are facing, they will maybe be prescribed different forms of antidepressants. Now the most common form of antidepressants are a family of antidepressants called SSRIs. Now this stands for selective serotonin reuptake inhibitors. Now primarily those antidepressants in the SSRI family include things like citalopram, fluoxetine for example. So these are the most commonly prescribed antidepressants. They're common for things like anxiety and depression, and the NICE guidelines here in the UK have stated that those are the most common antidepressants for a reason, and it's largely to do with the fact that they have the fewest side effects of any form of antidepressant. So how exactly do SSRIs work? Well, fundamentally, they increase the brain's exposure to serotonin. Serotonin is fundamentally a chemical messenger. It's like a neurotransmitter where it carries messages from different parts of the brain. And serotonin is very heavily linked to depression and anxiety in the sense that serotonin helps us actually regulate our mood. So SSRIs work in a way in which they stop the reabsorption of serotonin, meaning that when we reabsorb serotonin in the brain, we're depleted of serotonin. What the antidepressants do, or what the SSRIs do, is they stop that from happening as much. So what fundamentally happens is that we end up with more serotonin in our brain as a result of taking those SSRIs. The theory goes that the more serotonin that you have in your brain, the more likely you are, the more able you are to actually help regulate your mood because of how much serotonin is linked to regulating mood. So we understand a little bit more about antidepressants, primarily SSRIs. The question, and primarily the topic of this video, is how effective are antidepressants in comparison to therapy? Well, in 2015, there was a systematic review conducted by researchers at the University of North Carolina that found that antidepressants could be as effective as talking therapies. They looked at 11 different studies and over 1,500 patients and found that antidepressant usage had a very similar positive outcome to talking therapies. However, we do need to kind of take these results with a bit of pinch of salt. They only utilized citalopram as the antidepressant that they measured, and they only utilized cognitive behavioral therapy as their therapeutic approach. So there's limited results that we can actually find from this study, but what we can conclude is that there might be some evidence to suggest that antidepressants can be just as effective as therapy. However, these studies and studies like them, there have been numerous studies, have been impactful enough for us to actually influence them into policy. So like I said earlier, the NICE guidelines used here in the NHS in the United Kingdom have taken results from studies like that one that I've just stated, and stated that the most impactful form of treatment for people that are suffering from mental illnesses is a combination of antidepressants and therapy. Okay, so we understand a little bit more based on that research. We understand that there is some research that states that antidepressants can be just as effective as therapy. However, I will say, of course, there's research out there that says otherwise. There's research out there that says that antidepressants are more impactful than therapy. There's research out there that says that antidepressants are completely useless and the only intervention is therapy. So we always need to be thinking with a critical mind here. We always need to be taking these results with a pinch of salt. However, can we argue, off the back of some of the research we've talked about today, can we argue that the combination of antidepressants and therapy is doubly as impactful? Well, the first thing I'd say to that is that no, we can't argue that. What we can say is that the two are very effective, and ultimately you might be looking at the best results with a combination of the two. Now that's of course open to debate, I see clients, a lot of clients who are on antidepressants, who've been prescribed them. I see some clients who refuse to take them. I see some clients who haven't been prescribed them and have just come to therapy. What I would say is that these kind of things are always subjective. I'm going to talk a little bit about my own opinions on antidepressants and the combination with therapy in a minute, but it is the case that we can argue a little bit that, you know, if somebody's coming to therapy with severe OCD, severe eating disorders, or severe depression and anxiety, those antidepressants can take the edge off a little bit to actually help us conduct positive therapeutic work. I don't think it would be appropriate to look at the topic of antidepressants versus therapy without looking at the negative or even the dark side of antidepressants. Therapy and antidepressants are not comparable in every way. There's plenty about antidepressants that we need to be aware of and even need to be concerned about. People often report a lot of negative symptoms off the back of antidepressants, fundamentally around feeling numb to both the good and the bad. Things like dizziness, fatigue, nausea, and not being able to concentrate. All these negative symptoms can often be attributed to taking antidepressants. In my own work with clients, I hear reports of people finding positive experiences with antidepressants, but I also find people experiencing really negative things off the back of antidepressants. Often clients state, like I just said a minute ago, that antidepressants just numb the issue. Now, this is something that can be commonplace with clients who are taking antidepressants because they state that it's not just the bad things that are numbed. So it's not just their anxiety or the depression that's necessarily numbed, but it's also the good things in their life that they feel numb to. It's almost like their sensory input or their sensory circles are numbed a little bit off the back of these antidepressants. Clients also often report that they feel that they're just masking the issue, that taking an external pill to help deal with severe mental health issues like anxiety and depression is really just masking over the issue. Now, I completely relate to this, and in part I actually think that's where therapy comes in. You know, like I said earlier, antidepressants can take the edge off, that's absolutely true, and therapy can help us delve a little bit deeper to understanding a little bit more about what that anxiety and depression means to that person and how we deal with it better. There's also something to be said about a concern in clients that they're going to get addicted or they're going to get hooked or they're going to become reliant on those antidepressants. Now, that's something that we definitely don't want. We don't want that in therapy either. We don't necessarily want clients to become reliant on therapy. So I can understand how these clients have some severe concerns around their antidepressant usage. Now, often in GetPsyched, what I do is I'm very careful to not necessarily always share my opinion. I enjoy giving overviews of topics and letting people come to their own conclusions. But when we look at a topic like this that I feel quite passionately about, I think it is appropriate that I give a bit of my own perspective on this topic. The first thing I want to say is that I'm absolutely not a medic, nor will I ever be. Even though I'm a counselling psychologist in training, even when I'm a qualified counselling psychologist, I still won't have the ability or the power to diagnose or to prescribe or to manipulate dosages. So I am not a doctor. I always liaise with GPs, or at times I liaise with GPs to discuss about antidepressant usage, and I even can advise at times, but I don't have the power to prescribe or manipulate dosages. And one of the things I always say to my clients is to take their GP's advice. I ensure that in sessions I'm not saying, oh no, don't take that, I can't believe your GP did that, you should be on this, or you shouldn't be taking that. I make sure never to do that. If I am really concerned, I might talk to the GP, but that's the only time I might interfere. However, what I do experience in therapy is that antidepressants can play a role at times. Like I said earlier, they can take that edge off of people who are experiencing severe anxiety and depression or severe obsessive compulsive behaviours that are actually getting in the way of us conducting effective therapy. I don't think that antidepressants are the answer or even a answer. I don't think just taking antidepressants is an effective way of actually treating some mental illnesses or any mental illness for that matter. I think they play a very small role in the therapeutic process. Now, I know I can be really biased with this. You know, I work in therapy. Like I said, I'm a counselling psychologist in training. So I know I can be super biased here, but I think therapy is primarily the best option for anybody that's experiencing mental illness. And at times, yes, antidepressants can play a role. We need to be really, really careful about our prescribing habits though. We need to be really careful about what we're actually giving to individuals and how those individuals are utilising those antidepressants as the only form of treatment. I don't think that's effective. Okay guys, thanks so much for watching this week's episode of GetPsyched. We've been looking at the topic of antidepressants versus therapy, and I really hope that this video has been informative to you, giving you something to think about. You can go away and do your own research as well, and you can get in touch with me and let me know your thoughts. If you've been enjoying today's episode, then make sure to hit that like button. You can comment on the videos as well and I'll get back to you. And if you've been enjoying GetPsyched as a whole, you can hit the subscribe button and hit that little bell at any time in order to get weekly reminders every Monday of every time I upload. So hopefully catch you soon guys, and thanks so much for watching.